With the COVID-19 outbreak urging communities to observe health protocols, many sectors face a disruption in their projects and operations. During this time, LGUs need to step up and make sound decisions to balance the demands of responding to the pandemic while simultaneously engaging in planning to ensure that the community will have access to essential services, whether in public health or other basic social services. Despite the rise of COVID-19 cases, LGUs should also give importance to the continuity of other services, especially at the primary care level. These health services include immunization, maternal care, senior citizen programs, tuberculosis treatment, deworming, non-communicable diseases, medicine support, HIV/AIDS medication, family planning commodities, micronutrient packs, and other nutrition promotion programs. As LGUs continue to adopt measures to curb the spread of COVID-19, the delivery of primary health services has to undergo some innovation to maintain continuity of strong primary healthcare for all. On this note, the Philippine Alliance of Patient Organizations, or PAPO, developed 4 key considerations that LGUs should consider in rethinking or reorganizing the delivery of basic health services in the time of COVID-19. First on the list is availability, which ensures that the required type of quantity of essential products and services are provided. For instance, LGUs must come up with a system for distributing medicines and other services to patients during lockdown periods. These products and services must then be affordable to the community. Which leads us to the second consideration, affordability. This is concerned with the pricing of the products or services and the user's financial ability to purchase them. To improve affordability, LGUs must design strategies to prevent out-of-pocket spending of patients who can avail of free services in public hospitals and those who weren't officially admitted to health facilities due to capacity concern. The third key consideration involves accessibility, which pertains to the location of the product or service and that of the eventual user. In this aspect, LGUs must develop strategies to make healthcare more convenient, such as providing easy access to disease centers and accessible medical consultations while lockdown restrictions are in place. The last key consideration would be acceptability, which is concerned with the user's attitude and expectations. Here, LGU should develop communication plans to inform patients about the availability of medicines and services and address hesitancy in certain products, brands, or procedures. An effective solid risk communication strategy is vital to successfully provide essential goods and social services to the community. And according to the Asian Development Bank and McCann Global Health, government agencies, non-government organizations, community-based organizations, and private sector all play a vital role in carrying out a successful risk communication strategy. With prolonged lockdown measures, mobility restrictions, and closure of non-essential sectors, millions of Filipinos were left jobless. For many of them, hunger became a more immediate threat than the virus. Until the government comes up with a plan to prevent and address food security issues, many communities will continue to face the risk of hunger pandemic. That being said, the country's national and local leaders must work together and craft countermeasures against the risk of starvation. At the national level, policies supporting social services, particularly financial assistance, were enacted to aid community groups most affected by the pandemic. One of these is the Republic Act No. 11469, otherwise known as Bayanihan to Heal as One Act, through which the Department of Social Welfare and Development, or DSWD, was tasked to distribute a government subsidy under the Social Amelioration Program, or SAP. This subsidy was intended to aid senior citizens, persons with disability, pregnant women, solo parents, informal economy workers such as helpers, drivers, vendors, indigent indigenous peoples, and the homeless and underprivileged. Meanwhile, at the local level, LGUs are responsible for the distribution of cash assistance to qualified household or beneficiaries in their community. And in true bayanihan spirit, various non-government and private sectors, as well as the members of the communities themselves, rolled out initiatives to fight hunger. Many local chief executives also mobilized their own resources in addition to the support provided by DSWD to distribute in-kind assistance, re-employ laid-off workers, and support the continuity of education while students undergo blended or distance learning.